Why is lumbar epidural so significant in today's medical procedures? Let's jump right into it. The lumbar epidural is a cornerstone in modern medicine, a technique that has revolutionized pain management during labor and surgical procedures. What makes it so special? Well, it's all about location. The lumbar region of our spine is a gateway to the nerves that control the lower half of our body. By delivering anesthesia directly to this area, we can achieve targeted pain relief, whilst leaving the patient alert and responsive. Lumbar epidurals are most commonly associated with childbirth, providing expecting mothers with much-needed relief during labor. It's a game-changer, allowing mothers-to-be to participate more actively in the birthing process, making the experience less about enduring pain and more about welcoming new life. But the utility of lumbar epidurals extends beyond the labor room. They're also an integral part of the surgical arena, particularly for procedures involving the lower abdomen and legs. For instance, during a cesarean section, a lumbar epidural can provide a safe and effective means of anesthesia, ensuring a comfortable experience for the mother while she remains conscious to meet her newborn for the first time. In the world of orthopedics, lumbar epidurals are often used for surgeries on the hip, knee, or foot. They allow for a smoother surgical process, and their benefits continue post-operatively, providing effective pain relief during the recovery process. But it's not just about pain relief. Lumbar epidurals also play a significant role in the diagnosis and treatment of chronic back pain, a condition that affects millions of people worldwide. By delivering medications directly to the source of the pain, physicians can provide patients with more precise and effective treatment. In summary, the lumbar epidural is a versatile tool in modern medicine. It's a testament to the power of targeted treatment, and its impact is felt every day in hospitals and clinics around the world. It's a technique that requires skill, knowledge, and precision, attributes that are at the heart of healthcare. Understanding the process and importance of lumbar epidurals is crucial for healthcare professionals. The spinal cord plays a key role in the lumbar epidural process. A marvel of biological engineering, the spinal cord is the main pathway for information connecting the brain and peripheral nervous system. It's a critical player in our ability to interact with the world around us, and understanding its anatomy is fundamental to procedures like lumbar epidurals. Imagine a long, slender tube, about 18 inches long and less than an inch in diameter. That's the spinal cord, housed safely within the vertebral column, extending from the base of the brain down to the lower back. It's divided into 31 segments, each giving rise to a pair of spinal nerves that branch out to the body. The cord itself is a complex structure composed of gray and white matter. The centrally located gray matter resembles a butterfly in shape, composed of nerve cell bodies, while the surrounding white matter contains bundles of myelinated axons, forming the neural highways that carry signals to and from the brain. When we consider lumbar epidurals, we're interested in the lower part of the spinal cord. The lumbar region, which lies between the thoracic region and the sacral region, it's composed of 5 segments, conveniently called L1 to L5. These segments correspond to the lower abdomen and the legs, precisely the areas numbed during a lumbar epidural. The epidural space itself, where the anesthetic is injected during a lumbar epidural, is located outside the dura mater, one of the 3 protective layers surrounding the spinal cord. It's crucial to understand this anatomy to avoid damaging the sensitive structures within. The spinal cord structure and function underpin the success of a lumbar epidural. By injecting anesthetic into the epidural space, the nerve signals traveling through the spinal cord can be blocked, providing pain relief or anesthesia. But to do so safely and effectively, one must have a strong grasp of this intricate anatomy. The spinal cord isn't just a conduit for nerve signals, but the foundation of our interaction with the world, and an essential part of medical procedures like the lumbar epidural. Identifying dermatomy landmarks is a vital step in preparing for a lumbar epidural. Let's dive into the concept of dermatome coverage. A dermatome is an area of skin that is mainly supplied by a single spinal nerve. There are 8 cervical nerves, 12 thoracic nerves, 5 lumbar nerves, and 5 sacral nerves. Each of these nerves relays sensation from a particular region of our skin to the brain. Now, why is this important for a lumbar epidural? The answer lies in the direct correlation between the dermatomes and the spinal nerves. When administering a lumbar epidural, the anesthetic is applied to the nerves that correspond to certain dermatomes. This means that understanding dermatome coverage is crucial to predict which areas will be numbed. let's focus on the key dermatome landmarks that are useful in the lumbar epidural procedure. Firstly, the umbilicus, or belly button, is a key landmark. It corresponds to the 10th thoracic dermatome, or T10, which is often targeted for abdominal procedures. Secondly, we have the groin, corresponding to the first lumbar dermatome, or L1. This is a critical landmark for surgeries involving the lower abdomen and upper thigh. And lastly, the posterior superior iliac spine, or the dimples at the lower back, corresponds to the second sacral dermatome, or S2. This landmark is particularly important for procedures involving the buttocks or lower extremities. So you see, understanding dermatomes isn't just about memorizing a map, but about understanding the connection between the skin, the nerves, and the specific areas that we aim to numb during a lumbar epidural. This knowledge helps us to accurately predict the area of anesthesia and to monitor its effect. Remember, each patient is unique, and the dermatome coverage can vary slightly. Therefore, it's important to always assess the patient's sensory level before and after the procedure. Knowing these dermatomy landmarks can aid in the successful administration of a lumbar epidural. And with that, we have covered the essentials of dermatome coverage and landmarks. Proper patient positioning is crucial for a successful lumbar epidural. So let's delve into the optimal position for a patient receiving this procedure. The patient should ideally be seated, with their back curved in a C shape. This position opens up the spaces between their vertebrae, making it easier for the healthcare provider to find the right spot. The patient's chin should be tucked into their chest, and they should be leaning forward onto a table or bed for support. Alternatively, the patient can lie on their side in a fetal position. Knees should be drawn up to their chest, with their chin tucked in. This position also opens up the spaces between the vertebrae, facilitating the procedure. In both positions, it's essential for the patient to stay as still as possible. Movement can make the procedure more difficult and increase the risk of complications. Remember, correct positioning can significantly enhance the success rate of the procedure. Insertion and depth are critical factors in the lumbar epidural process. To understand why, let's delve into the procedure itself. The lumbar epidural is a technique where a thin needle is carefully inserted into the epidural space in the lower back. This space is located outside the dura mater, a protective covering of the spinal cord, but within the vertebral canal. The needle insertion is a meticulous process that requires precision. The healthcare professional must identify the right spot for the needle to go in. This is typically between the 4th and 5th lumbar vertebrae, where the risk of puncturing the spinal cord is minimal. The needle is then gently guided through the skin, subcutaneous tissue, and ligaments before it finally reaches the epidural space. Now, let's talk about depth. The depth of needle insertion is vital because it determines whether the needle reaches its correct destination, the epidural space. Too shallow, and the medication won't reach the targeted nerves. Too deep, and there's a risk of puncturing the dura mater, leading to a dural puncture headache, or even worse, causing damage to the spinal cord. The depth varies from patient to patient, depending on factors such as the patient's body habitus and the specific anatomical location. It's typically somewhere between 4 to 6 centimeters. Throughout the process, the healthcare professional must rely on their knowledge, experience, and tactile feedback. They must feel the resistance given by the different tissues the needle passes through. When the needle enters the epidural space, there's a distinct drop in resistance, often described as a give or a pop. This drop in resistance is a key indicator that the needle has reached the right depth. Once the needle is correctly positioned, a small tube or catheter is threaded through it. The needle is then removed, leaving the catheter in place to deliver the medication. In conclusion, the lumbar epidural is a skillful procedure that demands precision and expertise. The process of insertion and the depth to which the needle is inserted play a pivotal role in the success of the procedure. The precise insertion and depth are vital for the efficacy of the lumbar epidural. The loss of resistance technique is a key component in lumbar epidurals. Now, let's delve deeper into what this technique entails and why it's crucial in the process of administering a lumbar epidural. The loss of resistance technique is a time-honored method used to identify the epidural space, a critical step in the administration of epidural anesthesia. Imagine navigating through layers of tissue, each with its own unique texture and resistance. The epidural needle, when advanced, encounters these various layers, each providing a certain degree of resistance. The loss of resistance technique involves feeling for a sudden decrease or loss of resistance, which signals that the needle has entered the epidural space. But how exactly is this technique performed? The anesthetist attaches a syringe filled with air or saline to the epidural needle. As the needle is advanced, the anesthetist periodically attempts to inject the contents of the syringe. While the needle is in a ligament, the resistance to injection is high. However, once the needle enters the epidural space, the resistance drops significantly, allowing the contents of the syringe to be easily injected. This sudden loss of resistance indicates that the needle has entered the epidural space. Why is this technique so vital? The epidural space is a narrow, delicate area located between the dura mater and the inner surface of the vertebral canal. Accurate identification and access to this space are key to the successful administration of epidural anesthesia. The loss of resistance technique provides a reliable, tactile feedback mechanism for the anesthetist to accurately locate the epidural space, reducing the risk of dural puncture and other potential complications. In a nutshell, the loss of resistance technique is a vital skill that requires practice and finesse. It enables the anesthetist to feel their way into the epidural space with precision and confidence, ensuring the safe and effective delivery of anesthesia. Mastering the loss of resistance technique is essential to ensure a successful lumbar epidural. Lumbar epidurals have proven to be extremely beneficial during labor and cesarean sections. Our journey into the world of lumbar epidurals now takes us to the delivery room. Here, the use of this method has revolutionized the way we manage pain during labor and childbirth. It's an exciting development, providing not only pain relief, but also an increased sense of control and comfort for the expectant mother. With a lumbar epidural, the anesthetic is administered into the epidural space in the lower back. This blocks the transmission of nerve signals from the lower half of the body, effectively numbing the pain of contractions. The result? A laboring woman can be fully awake and alert during childbirth, and yet be comfortable and pain-free. It's a remarkable balance that enhances the childbirth experience. But the story doesn't end there. Lumbar epidurals also play a significant role in cesarean sections. In a cesarean section, where a baby is delivered through a surgical incision in the mother's abdomen, a lumbar epidural provides effective and safe anesthesia. It allows the mother to be awake during the procedure, to hear her baby's first cries, and even to hold her newborn soon after delivery. The anesthetic used in a lumbar epidural for a cesarean is usually stronger than that used for labor. It ensures that the mother feels no pain, only pressure, during the surgery. It also reduces the risks associated with general anesthesia, such as nausea, vomiting, and respiratory complications. The benefits of lumbar epidurals in these scenarios extend beyond the immediate procedure. Post-operative pain is notably lessened, allowing for a smoother recovery. The mother can start walking sooner, which reduces the risk of blood clots and speeds up the healing process. In conclusion, the use of lumbar epidurals during labor and cesarean sections has transformed the landscape of childbirth. It offers a safe and effective way to manage pain, enhance patient comfort, and promote a positive birth experience. The advantages of lumbar epidurals during these procedures are undeniable. The lower extremity motor examination is a crucial part of the post-epidural assessment. Now that we've covered the procedure of the lumbar epidural, it's time to delve into the follow-up examination, specifically the lower extremity motor examination. This is a vital step in ensuring the patient's well-being and the efficacy of the epidural. The examination begins with the hip. The patient is asked to flex and extend their hip, assessing the strength of the iliopsoas and gluteus maximus muscles. This can provide insight into the integrity of the lumbar nerve roots. Next, we move to the knee. The patient is asked to flex and extend their knee to evaluate the quadriceps and hamstrings. This can be an indicator of the functioning of the lumbar and sacral nerve roots. The ankle is then examined. By asking the patient to perform dorsiflexion and plantar flexion, we can assess the strength of the tibialis anterior and gastrocnemius muscles. This can reflect the functionality of the sacral nerve roots. And finally, the toes. The patient is asked to flex and extend their toes, providing a glimpse into the strength of the small foot muscles. This can help us understand the integrity of the sacral nerve roots. Each of these movements should be performed bilaterally, on both the left and right sides for a comprehensive examination. Why is this examination so important, you might ask? Well, it assists in identifying any potential motor deficits that may have resulted from the epidural. This could include weakness or paralysis, which may signify nerve damage or complications from the epidural. Additionally, it helps to confirm that the epidural has been successful in numbing the appropriate dermatomes without affecting motor function. This is a crucial balance to strike in ensuring that the patient is comfortable and pain-free, but also safe and able to move. In conclusion, the lower extremity motor examination is a critical component of the post-epidural assessment. It provides valuable information about the patient's neurological status and the effectiveness of the epidural. This examination ensures the patient's safety and the success of the epidural. Let's recap the key points of the lumbar epidural process. Lumbar epidurals are an integral part of modern medicine, offering pain relief in labor and cesarean sections. Our backbone plays a vital role here, housing the spinal cord that's sectioned off into dermatomes. These dermatomes not only cover our body but also serve as important landmarks for administering epidurals. Patient positioning is crucial. A well-positioned patient can significantly ease the process. The needle insertion guided by these dermatome landmarks and its depth are equally critical to ensure the anesthetic is delivered accurately. Techniques such as the loss of resistance method help verify the needle's correct placement. The magic of lumbar epidurals unfolds in labor rooms and operating theaters, providing relief during childbirth and cesarean sections. Lastly, the lower extremity motor examination helps assess the epidural's effect. By understanding these key components, healthcare professionals can ensure the safe and effective administration of lumbar epidurals.